Hey guys, Dr. Rob here today, and I wanted to welcome you to my next whiteboard session. Today we're going to talk about how you test yourself for leaky gut. Now, if you're unfamiliar with leaky gut and what it is, I put a link down here to another video or a couple videos that I've done where it covers the topic of leaky gut. So I please encourage you to go and take a look at that. Leaky gut, we know, is associated with so many health problems. A lot of autoimmune diseases, such as Hashimoto's thyroiditis, rheumatoid arthritis, Still's disease, which is basically rheumatoid arthritis in a child, lupus, multiple sclerosis. So many different diseases are associated with leaky gut. We also have conditions like autism, fatigue, general arthritis and pain, inflammation in the body, and a host of other conditions. So how can you test yourself for this? Well, one of the tests that I really like is to look at your zonulin levels. Now, what's zonulin? Let me sidestep over here. So zonulin is a substance that's made in your gut. And zonulin helps to open up the gaps, open up the spaces in between the intestinal cells, so that way nutrients can get into our bloodstream and we can absorb things like vitamin C, vitamin B, amino acids, and carbohydrates and all that good stuff. The problem is sometimes zonulin levels get out of control. They get way too elevated. And when they get too elevated, the gaps then get too big. When the gaps get too big, it's not just the good stuff that starts to leak in, but it's the bad things that start to leak into our body, and we can start to develop food sensitivities, skin disorders, and a host of other issues. So zonulin is a great thing to look at. I love to look at that. I also like to look at two other things. One is mannitol and lactulose levels. So mannitol and lactulose, they don't really cross the membrane of the intestines very well and get into the bloodstream. So what you do with this test, it's a 6-hour urine test, and before the person does it, they take some mannitol and they take some lactulose, and then you collect your urine over the next 6 hours and we see how much gets through. And if there's too much that's gotten through, that's a no good. So the other thing I like to do is there's an organic acid study that looks at levels. It's done through urine. Organic acid studies are typically done through urine. And there's a level we're looking at called tricarbonate. And tricarbonate is a compound that's produced when you start to get overgrowths of bad bacteria in the gut. Tricarbonate should never really leak into the bloodstream, but when there's a large quantity of tricarbonate in the body, well, those bad bacteria, parasites, candida, all those things can actually make your zonulin levels rise. And again, when your zonulin levels rise, the gaps between the intestinal cells increase. As a result, the tricarbonate leaks into the bloodstream, and when it gets into your bloodstream, you then urinate it out, and we pick it up on your test. So I hope that was helpful. Those are some good tests and some good ways you can identify if you do have leaky gut, and if you do, handle it right away, especially if you have any of the conditions that I've talked about, including adrenal fatigue, thyroid problems, liver problems, any of that stuff. I mean, our health really does begin in our gut. So if you like this information, please subscribe to my channel and share it with a friend. If you have a health or weight issue, or maybe you think you have leaky gut and you want to get tested, and you want us to test you, I'm happy to do that. Or if you just want some help, please, I'm going to put a link down here to my website. Please feel free to go to my website and fill out the free online weight loss and health evaluation. And then one of my amazing staff will call you for a free consultation to cover the results of the health and weight loss evaluation that you filled out, and they'll explain more about how we can help. So again, I really hope you enjoyed this information, and I look forward to seeing you at the next whiteboard session.